Hi everyone. Today I have chosen to speak on the topic menopause. So we hear a lot of women in their early 40s, late 40s, in their early 50s speaking about menopause, the symptoms they are coming across, the mood swings they are coming across. So I've chosen this topic because this is really very important. What is this menopause? Menopause is the complete absence of a regular periods for about 12 months, that is up to 1 year. If you do not get your periods, then we declare that you have attended menopause. So before I speak about menopause, I would also like to discuss on the phases before and after menopause. The phase before menopause is called a perimenopausal phase or a perimenopausal period. It starts 4 to 8 years before menopause. We usually women secrete a hormone called estrogen. As we age, say after 30 years, the estrogen content in our body starts decreasing. After 35, it decreases at a faster rate. Post 40, further faster rate. So in this perimenopausal phase, what happens is the estrogen hormones slowly starts to decrease. And this period starts for some women in their early 30s and for some women in their early 40s. Because we say usually a woman attains her menopause, or the average age at which an Indian woman attains menopause is defined as 47 to 53 years. So you can calculate 4 to 8 years before this menopause is called the perimenopausal period. What are the hormonal changes which happens during this perimenopausal period? As I said, the estrogen hormone, which is a woman-friendly hormone, starts decreasing, and the FSH hormone slowly starts increasing. So during this phase, a lot of changes happen in our body. Our periods, which were regular well before, starts decreasing. That is, it either becomes irregular or we start skipping our periods. The periods which were normal in duration starts becoming heavier. That is, the flow starts increasing, or it might also become decreased flow. The other changes are hot flushes. So what is this hot flushes? Sudden feeling of warmth in our body is called hot flushes. And vaginal dryness. That is, you feel the vaginal skin starts becoming itchy, especially after intercourse. Sometimes the intercourse itself becomes painful. And there is also a probability that you might start to bleed after intercourse because of the increased vaginal dryness. Next comes the urinary changes. You feel that the urge to pass urine has increased. You frequently feel like passing urine. The other changes are mood swings, sudden feeling low energy levels, increased anxiety, short-temperedness, getting angry unnecessarily. Some women start feeling depressed. Some start crying. They feel so depressed that they start crying unnecessarily. The other things is you see that you start to have some spotting kind of a bleeding in between the periods. So these are the things which usually the perimenopausal lady comes across, and this is an indication that very near or in another 4 to 8 years or 4 to 5 years she's going to attain menopause. So what happens is this phase is like something you can say a very dangerous phase. Why dangerous? I'll tell you, because your cycles become so unpredictable. So you cannot plan up your trips, your vacation, temple visits, because your cycles are so unpredictable. The other thing, the most important thing is, even though your estrogen hormones production in the body decreases, there is a high possibility that you may also become pregnant. So these are the things which actually a perimenopausal woman faces. So now, when do a woman who is in a perimenopausal period has to meet a doctor? So this is a natural phenomenon which we all women go through. But sometimes when these symptoms really disturbs us, or it comes in between our daily activities, it disturbs our daily day-to-day activities, that's when you have to seek the help of a gynecologist. Like periods becoming very heavy or spotting in between the periods, your sexual life getting disturbed, bleeding after intercourse, your mood swings which becomes really uncontrollable, your family, you feel that your family is being affected because of your mood swings, or you start to pass heavy blood clots in your periods, that's when actually you have to seek the help of your gynecologist. So how do you diagnose this perimenopausal phase? As I told you, the estrogen hormone starts decreasing and the FSH hormone slightly starts increasing. So what is the treatment available for this perimenopausal period? So the one thing is, we gynecologists do suggest oral contraceptive pills to regularize your hormone production. Some give only the estrogen therapy because, as I told you, this estrogen hormone starts decreasing. The estrogen therapy is given either in the form of tablets, gels, patches, and vaginal creams are given so that you don't come across this vaginal dryness. Lubricating gels are given to make you feel comfortable during your sexual intercourse. Most important thing is, decreased estrogen production will have an impact on your bones. So calcium supplement, taking calcium supplement is the most important thing. And some people suffer from insomnia and some undergo depression episodes. In such cases, we also prescribe antidepressants for a short period of time, so that till you overcome that period, you are comfortable taking this medicines. It's not like once you start antidepressants, you take it for a lifetime. It's just for a short period to overcome that phase. But remember, this estrogen therapy what we give will always have some or the other side effects. Like it can have an impact on your heart. It can lead, if you take it for a longer period, it can have an impact on your uterus, leading to increased thickness, increased thickness of your endometrium, that is a uterus inner layer. That might sometimes lead to uterine related cancers, and it might form clots in the body, blood, and that might lead to stroke, heart related issues. Some women also suffer with gallbladder diseases. So this is about the perimenopause. Now what are the home remedies you actually can do to overcome this perimenopausal phase? The best thing is, eat healthy, take lots of fruits, vegetables, hydrate yourself, meditate, exercise, keep your thyroids under continuous check, make sure it is under normal limits so that you don't put on excess weight. Stress management, try to manage the stress. See, we all have stress, but managing that stress is an important thing. And if you're a heavy caffeine intaker, means taking too much of coffee, please reduce or completely avoid it. Early morning exposure to sunlight is a natural source of vitamin D3, which takes care of our bones and calcium. If you're smoking and all, please do please quit smoking. The other thing is taking adequate rest, trying to catch up good sleep. If you really have to catch up good sleep, the most important thing is you have to exercise. And watch on your diet, because post-menopause thyroid related issues becoming diabetic is all quite high. So watch on your diet. So this is about your perimenopausal phase. Now let me talk about the menopause. What is this menopause? When do we say a woman has attended menopause? When there is complete stoppage of periods for at least 12 continuous months. That's when we call she's attended menopause. So what happens during this phase? Already, as I told you, the estrogen hormone has started decreasing in the body. There will be complete stoppage of estrogen production in the body, and the FSH hormone slightly or excessively increases in the body, and the symptoms whatever she was experiencing in a perimenopausal phase usually increases, like the hot flushes becomes more, the vaginal dryness becomes more, weight gain, bones becoming weak, low mood, low sex desire, mood swings, depression, insomnia, then periods, as I told you, like completely stoppage, so you feel bloated, you feel heavy lower abdomen, all the symptoms starts aggravated. So the types of menopause, as we say, natural menopause, which is like naturally a woman undergoes menopause, that is completely stoppage of her cycles for 12 continuous months. The other thing is when we undergo a surgical procedure, like if you are suffering from fibroids and we undergo a hysterectomy, uterus removal procedure, that is a surgical induced menopause. The other thing is premature ovarian failure. That is early 30-35 only women, their ovaries stop functioning. Ovaries are the organs which produces estrogen. So it is called hormone related menopause. The worst condition is cancer related menopause, that is due to some cancer affecting the ovaries or the uterus, where the ovaries or the uterus are removed, or she undergoes a radiotherapy or a chemotherapy. That's the cancer induced menopause. So here there is complete stoppage of the estrogen production in the women's body. So what are the treatment available for this menopause? As I already told you, some women who actually require treatment are obese women and already having thyroid related issues or any PCOD issues. They are the ones who undergo this lot of mood swings, knee joint pains, body aches and all. So they actually require treatment, or else as such we women do not require any treatment during this menopause. Only thing what we should take care is our bones and thyroids. So taking calcium supplement is recommended. But some women who really cannot bear the complete stoppage of estrogen production in women, for those people we give this hormone replacement therapy. What is this hormone replacement therapy? That is, estrogen is given outside, from outside, means it is not, the body is not producing estrogen, so we give exogenous estrogen. That is, some we give in the form of tablets, for some women we give in the form of gels, patches, and for some to overcome this vaginal dryness we give some estrogen gels, lubricating gels. These are the things which we actually give as supplements in the in the menopausal women. This is called as hormone replacement therapy. As I already told you, because of this hormone related therapy, she is at high risk of this cardiovascular diseases, that is heart related issues, gallbladder stones, blood clot formation, and uterus related cancers, stroke, joint pains, and pulmonary embolism, that is the clots getting formed in the lungs or in the brain or in the heart. So these are the things which are most commonest side effects of this hormone replacement therapy, and it is only given to those women who cannot bear the side effects of menopause hormonal decreased production. That is, their body is already producing low estrogen and they are not able to combat, their body is not able to combat for the decreased estrogen production. Only in such women, for a shorter period of time, till their body gets used to that complete stoppage of estrogen production, we give them. If you take it for a shorter period of time, definitely it has no side effects. But when you take it for a prolonged period of time is where all the side effects come. So do not misunderstand. Again, I'm repeatedly telling, after menopause, if you take treatments with hormone for a shorter period of time, it does not have any side effects. When you take it for a longer period of time is where all this heart related issues, stroke, blood clots in the lungs, brain, heart and all forms, or else definitely it doesn't have any major side effects. So now, what are the other non-hormonal therapy? Apart from giving hormones, how can we actually overcome the symptoms of menopause? As I told you, exercise, eating healthy, quitting alcohol, quitting smoking, quitting caffeine, stress management. See, and there are so many groups, menopausal groups. Discuss about your menopausal symptoms with your friends, your colleagues, and once you discuss, you share your problems and you come to know about their problems, you feel comfortable. I'm not the only woman who's undergoing all these changes, it's also my colleagues. So it is a natural phenomenon. Discuss and manage your stress, go for exercise, eat healthy, and there are some plant sources of estrogen like soya beans, flax seeds, chickpeas, beans. These are the ones which provide natural estrogen. So please take adequate plant source of estrogen to combat with your estrogen, is to compensate for your estrogen loss in your body. The other things, as I told you, join the menopausal groups. If you discuss your problems, you also feel there are so many women undergoing this same phenomenon. So I'm not the one who is suffering. So let me also discuss and let me also know about that problem, and your body and your mind accepts menopause in a better way. So this is about your menopause. So next comes the last phase, which is the postmenopausal period. What is this postmenopausal period? It is again 4 to 8 years. following the menopause. What happens over here is the symptoms slightly starts decreasing, all the mood swings, everything comes under control. You start catching up good sleep. The only thing, as I told you, weight management is something which you have to take care, because after menopause we women tend to put on lot of weights. Keep your thyroids under regular checkup, keep your sugars under regular checkup, keep your hearts under regular checkup, keep your bones under regular checkup, take calcium supplements, walk, eat healthy, hydrate yourself. I think if you do this, menopause is nothing to get scared of. It's very easy to tackle because this is a natural phenomenon. We attend puberty, we get our cycles every month in a reproductive period. Same again, late 40s we also undergo menopause, that is complete stoppage of period. So these are all natural processes which a woman undergoes. So there is nothing to get scared. Just managing it in a right way is the art of fighting against menopause. So if you have any doubts regarding menopause, always reach out to me. I am available for your video consultation also. You can also come down to my clinic. I also consult in this Cloud9 Hospital, Kanakpura branch. You have any doubts, you can always reach out to me, and the number to do a video consultation is by messaging on WhatsApp on 9739463172. So once you message, you can register a video consultation with me, discuss about your menopausal or the perimenopausal problems, issues. Let me help you in fighting with it, and let me make your life more simpler and happier. Thank you.